the TikTok Live. I'm going to be mentioning you as a shout out. TikTok Live number 37. Here we go, friends. First question was asked. I hit the start button. We got a couple questions coming in here now. Again, I'll be recording this right now for the podcast later on, YouTube channel. The top 3 listeners for the entirety of the TikTok Live, I'm going to be giving a shout out in the caption of the podcast. All right. Smiley Face said, Smiley Face is the first question asked. Do you know much about TMJ? Yeah, I know a thing or two about TMJ. I know a thing or two. It's TMJ is, well, first of all, it's the TMJ stands for the temporomandibular joint, and technically what I think you're referring to is TMD, temporomandibular like disease, like the joint disease. And yeah, there's a lot to it. There's a lot that goes into it. I feel like this is crooked, no? All right. Katie liked the live. Thanks, Katie. What else we got? Smiley Face, can it be treated without surgery? Absolutely. Well, you got to differentiate. Like, is your TMD more myofascial, like pain? Is it involved the muscles? Is it involving the nerves? Or is it actually a functional problem? Is it in the joint itself? You know, is it osteoarthritis? There's so many things that it can be as far as TMJ goes or TMD goes. Kathleen Mullins asks, would you rather meet Danny DeVito or Woody Harrelson? Danny DeVito. Born Queen joined. What's up, Born Queen? YoFam888 said, what order should someone use resources for studying for the CBSE? Pathoma, Boards and Beyond, First Aid, Sketchy, or NBME exams? First of all, the NBME exams I found to be really not very representative of the actual tests. So I wouldn't use that. For B&B, that's Boards and Beyond. I wouldn't even use that anymore. If you listen to the podcast I did with Brandon Axelrod, we went through, it's called CBSE Dissection. You can look it up on Spotify, look it up on YouTube. It's all on there. It's like a 45 minutes. We dive in and we go through all the resources, the strategy, and how to basically get the best score you can get on that exam. And why do I bring that up? Because we basically, Axe said that Boards and Beyond was what kind of like my year used to study. This is like 7 years ago. Like 6 years ago. Now the boot camp is better and replaces B&B. So we're using boot camp now, no longer B&B. You didn't mention First Aid for the US only. That's good. UWorld is a question bank. Amboss is a question bank. Listen to that podcast. Again, it's called CBSE Dissection that I did with Brandon Axelrod. Those are everything you need to know to study for that exam. Okay, let's go. Let's keep going. Big Osk, OSC. If you get paid more as an influencer than as an attending, will you work less hours as a DDS? Well, those are two kind of that's a statement and then a question, and they're not actually related. I don't do influencing. You know, I'm not getting paid for this. I do this for fun. I do this to mentor. I do this to help out other people. I really enjoy podcasting. As far as content goes, I think it's really good to kind of shed some light on what you go through on a daily basis, what you do on a daily basis, right? Like how many people actually knows in the general populations, how many people actually know what goes on in a hospital setting? Like none, less than a fraction of a percent, you know, nurses, doctors, PAs, that's about it. And that's not that many. And even so, like the residency experience is much different than you know. So, but no, like, yeah, influencers, some get paid a lot of money, but they're all sellouts. And I'm not a sellout. I'm not doing this for money. I'm doing this for fun. See Benji. What's up, Benji? What's going on? Have you done or seen an all-on-X case? I've done 16 all-on-X's in the last year and a half. Just saw one and it was awesome. Yeah, they are awesome. They really are awesome. I love doing all-on-X cases, zygomatic implants. It's fun to plan all-on-X cases using the DTX program. So that's like a virtual software you plug the CBCT radiograph into, and then you could plan it based on where the bone is and away from where the bone isn't, right? Bob said, had TMJ, got braces, and it went away. No problem since. Interesting. Some patients will say, you know, they got TMJ after they put braces on because it shifts. It can potentially collapse your bite. Who knows? Billy Boy 518 said, I thought OMFS were MD/DO. No, they're not DOs. It's MD/DDS or DMD. The DDS and DMD, that's the same thing. That's a dentist degree, okay? Some oral surgeons, OMFS, some of them get the MD. Some of them don't. There's a 4-year track and a 6-year track. The 6-year track spends those 2 years in medical school, learning about other parts of the body. And the track that I'm in is the 4-year, where we do just as much oral surgery training, if not a little bit more. We do a little bit more on service, like doing oral surgery than them. Believe it or not, when you do the math, we have like 4 more months on service doing oral surgery, whereas they have a little bit more time. In 6 years, they have more time off service than they are on, meaning less oral surgery. That being said, you know, the MD doesn't make you get paid more money. It doesn't make you more important as an oral surgeon. It can potentially help you if you apply to fellowships, but I'm not doing a fellowship. I don't know. And if you're curious about it, you should look into that stuff. It's not what you think it is. IHuff Freon said, should I include alien abductions in my medical history? Probing questions. Yeah, I mean, your alien abductions can be significant for other things potentially that you have in your medical history. So yeah, I think that's a good one. YoFam said, thank you. Yeah, you got it, YoFam. User 393494. All right. Do you feel doctors should be represented more in soda? I mean, you have pepper and that's it. Yeah, we should probably have Dr. Cola, Dr. Pepsi, because you have Dr. Pepper in there. That's a good question. Dr. Root Beer, that would be my favorite. Root beer, I love root beer. Not Hawk, I'm a big B-Axe fan. I don't know what that means. Brendan Knob said, best dental schools in the Midwest, UMKC or Marquette? They're both pretty good schools. Which one's better? I don't know. I can't tell you which one's better for you, which is ultimately the more important question. You should go on predentmentormap.org. That's a service it's a website that has all the data for dental schools in the United States, right? So you could see the class size, you could see the tuition, you could see average DAT score to get in there. I would check that out. And then you could kind of look at, generally, I mean, obviously you want to factor in tuition, but you should also, geez, guys, it's the election tomorrow. You should also factor in class size, because generally smaller classes, they have a much better, you get much more one-on-one in-person time with the faculty members to learn dentistry, which is kind of important, Angie Reyna said, for a second I thought you were the Dr. Hunt from Grey's Anatomy. I can be. Big Osk said, I asked that because a lot of influencers have been leaving medicine because they leave the medicine bubble. Yeah, dude, they're doing it for a good reason. Now, again, like, influencing comes with a bad connotation. Saying they're all sellouts. It's like they're just trying to sell you their discount code and stuff. I don't know. It's sad. I guess they got to do what they got to do. But I don't know. I think this life is about much bigger things than that, and just being a sellout salesperson. Just my thoughts. Yeah. And yeah, the medicine bubble is a serious thing. Healthcare is not what it was 20, 30 years ago. Healthcare is trending in a very not good direction, a very dark direction, I would say. And I could go into that in more detail if you're curious. I don't want to talk your off about that. I want to get to more questions. JFCJDB Hazok, when did you start receiving dental school interviews? I started receiving them in September, October. Yeah, September, October, and I think I got one in November. Sammy Drew 16 said, it's been 3 days and still numb and swollen. From what and where? AxL261 said, what were your stats applying for dental school? My stats applying for dental school, I had a 3.6 GPA from college, Stevens Institute of Technology, and NYU Poly. I had a 21 average DAT score with a 22 on the PAT of the DAT, and I had done research in undergrad, played basketball in college. What other stats are you looking for? David asked, Trump or... Yeah, because the election's tomorrow. I already voted. Did you guys vote yet? Hopefully at this time you voted already. Looks like I got bedhead, but I don't. It's just my little bandana I wear when I work out. Push it up. Yeah, I don't know. I think the answer to that, actually, I do know. And I think the answer to that is pretty obvious. Gotta do your research. I recommend listening to long form content. I think both sides had a lot of speeches, had a lot of interviews, and I think it's a really good idea to get full-length version content of either side, because either side can easily twist the other's words. They can easily twist each other's sentences. And I think it's very important to watch full-length interviews that weren't edited, that weren't curated. That way you could get the best information directly from the source, not something that's been edited and revised. That's what I would recommend. So I'm not going to tell you that, but I'm going to tell you how I think you'd get the best opportunity to make the most informed decision, and not just listen to the media, not just listen to your favorite social media app, but actually make an informed decision yourself. IHuff Freon followed the live creator. Oh, thanks, friend. Thanks, IHuff Freon. Ashton said, can a delinquent become a doctor surgeon? I've heard stories. In fact, I've seen it. Shrek's left nipple. How did you do in the CBSE? Best thing to study. Well, that's tough. I mean, I got the score I needed, Could always be better, I'm sure. Best thing to study? Well, obviously the UWorld Q Bank and First Aid, the book for the USMLE Step 1. Those are definitely at the top of the list. But, there's so much that goes into it. I like Sketchy for Sketchy Micro, Sketchy Farm. You have Boot Camp for Path, for Physio. Yeah, there's a lot of stuff. Shiv Patel. What's up, Shiv? Any tips for interviews? Yes. The interviews are a conversation. Don't go into an interview thinking like it's a multiple choice exam, because it's not, and it's not going to go over well if you kind of go into it with that mindset. It's conversation. You're just chatting with someone. and ultimately you're trying to guide the course of you're trying to sell yourself as a strong and wanted applicant without being conceited, without being overconfident. You just want to be genuine in who you are. If you do that and you chat with the other person like a human being, I think you'll do just fine. That's I know it seems easier said than done, but simplify it. Don't overcomplicate it. Have a conversation, just chat with the interviewer, and I think everything will go fine. Caroline said, my husband is in the middle of OMS residency interviews. Wish him luck. Well, good luck to Caroline's husband. Good luck. You got this. Again, it's a conversation. It's not a multiple choice exam, right? Not Hawk said, B-Ax is your podcaster partner. Well, Brandon Axel, okay, you call him B. I call him just Ax. But yeah, you could call him B-Ax. That's good. Sabir said, should I use boot camp to study for dentist entrance? Yeah, I think you could do that. Shiv M. Patel said, any interview tips for getting into dental school? I mean, it's the same thing, because interview tips, again, an interview is a conversation. It's not an exam, and you can't treat it as such. And if your interviewer's kind of treating your interview as an exam, like that's probably not, I don't know, that would not leave a good impression on me. And I didn't have any examples of that, so I wouldn't worry about it. Shadia Gonzalez, where to go? Shadia Gonzalez, here we go. In the app, Stephanie Miller, what's up, Stephanie Miller? I know someone who has dental insurance and it got and it covered next to nothing. Yeah, Stephanie Miller, dude, these insurance companies aren't doing anything. They were designed to get a broader population and patient basis treatment that's needed, right? And it is doing the exact opposite these days. It's crazy. It's so stupid. Shadi Gonzalez in the app cycle now, interviewed, now just waiting. Any tips on what I should do while waiting? Put yourself to work. Yeah, maybe not work necessarily, but exercise. Like, do stuff that you like. Don't sit around waiting for life to happen. Make the most of every day, right? Seize the day. Literally, go do something. Tony, would you ever do a fellowship? Absolutely not. I would do a fellowship if the incentive in healthcare again was what it was 20, 30 years ago, right? We need to advocate and get this healthcare machine back to being about patient-centered care, right? And in order to get the best patient care, you need to empower providers a lot better than they are now. I mean, they're taking away their hours. They're telling you when you need to work. Everything is paid for by insurance now. And when I say paid for by, they're not paying anything, but it's all assumed that everything in healthcare is paid by insurance companies. Doctors and dentists are graduating with the highest levels of debt ever in the history of education. That's a triple-headed sword right there. Where are we going to be in 30 years from now? I don't know. We need some bright minds that can create solutions to these current problems and to make the future 20, 30 years from now better than where it is right now. Because where it is right now, we're just going right off the deep end in healthcare, and it is very frightening to watch. Yeah, that's why you have so many people leaving. That's why you have more people graduating medical school than doctors working in the United States year after year. None of it makes sense. It's not good. So, I get really worked up about this because it's really sad to see. I got into healthcare because I thought patient-centered care, working with people, helping people is the greatest thing ever, and it is. But in a system that really falls short of the core values. Yeah, it's almost like a sinking ship right now, which is just scary. And and a lot of people aren't happy. In fact, most people, I would say more than 50% in healthcare are not happy. And it's not a good thing, right? Like, we should be talking about this more and getting our minds together and creating solutions. That's kind of where I see myself going forward in the future. I'm just going to try and survive residency. I got 8 months left. I already have a job for next year. I signed in July, so that's fine. I start in August, and then from there, just do an oral surgery. Let's talk, let's chat, let's advocate for the profession and other professions within healthcare, and try and build this and make it better than where we are right now. Evan Bruzy Chezzy followed the live creator. Thanks, Evan. Thank you, friend. Jay said, hey, man, in dental school right now with an interest in OS. Got any tips for study schedule for CBSE as a D1? D1, just worry about, my recommendation would be D1, just worry about getting through the year and working on handling your studying, getting good scores on top of school. Okay, that would be my recommendation. I wouldn't work in a CBSE study schedule into D1 year without knowing that you're in good standing, that oral surgery is it, because you're not doing you're not doing anything in the clinic right now. So I would take it one step at a time. And the way I kind of describe working on your studying is maximizing your efficient and effective studying. Effective studying is getting higher scores, right? 85, 90, 95. But efficient studying is maintaining those needs and studying less and less, right? And I think that's so crucial because dental school is like 32 credits a semester on average. So your D1 year is a lot, and it's a big transition going into D1 year like that. So user 1222, what kind of CBSE score ranges did people who matched from your dental school have? My buddy Ian Lynn, he's at UConn now in the oral surgery program there. He had a 98 on the CBSE. That's my boy. And he was one of my good friends in dental school. But CBSE otherwise, 60s, 70s is generally mostly 70s. Okay. Amid HDD as an international student, will I be able to make OMFS residency? I think you need to repeat at least 2 years in an international dental school in the U.S. and then you could probably try applying from there. I don't know if not every program will accept you as an international student. Sunlight World and Flowers said, you seem like you voted for Trump. Concepts of a plan. Wait, you're saying that I am giving concepts of a plan, so that would equate to me voting for Trump over Kamala? I'm not following. I'm not following. Brendan Knob at that person, LMAO. Why? What? Brendan Knob and I don't know. You don't have your name there, so I don't know. The world, sunlight, and flowers. What? I don't get it. Brendan Knob. Just after he said healthcare is headed down a bad path. Well, it is. Can anyone disagree with me and give me a solid argument saying that healthcare is headed in a better direction right now, 2024? Please, guys, I welcome you to let's talk about this. Tell me how healthcare is getting better. What, technology? But what about actually using that technology? It's not actually getting better. You know what I'm saying? And then look at the rates. If you look at the current society right now, you're seeing people as young as in the 30s and 40s starting to get cancer. That wasn't happening at the rate it is today 20 years ago. So are the pharmaceutical industry is actually doing their job? Is healthcare doing its job? We're starting to see a reverse in longevity. Maybe not quite yet, but when you have people getting cancer in young, 30s and 40s now, that will equate to longevity, right? So please, by all means, I welcome. Let's discuss this and let's talk solutions, right? Let's have a amicable discussion here. Amid HDD, as an international student, do I have chances to get into OMFS residency? You might. You'd have to repeat dental school in the United States for that. That's the rules right now. Soon K5 said, have you used Osteogen Plug? If so, thoughts? Nope, haven't used the Osteogen Plug. Bryson Green, may Jesus be with you. Repent, he is Lord and Savior. He died for our sins and resurrected. Thanks, Bryson. Yeah. I listen to Our Daily Bread every morning. It's a Christian podcast. It's 3 to 4 minutes, but they have a really good message. They take some excerpts from the Bible out of it and relate it to real day life. I recommend that. I really enjoy listening to that every morning. Sow's P. Yo, I'm pre-med, studying for the MCAT right now. It's awful and making me want to quit. Well, you're early in the game there, my friend. Well, you'll see. User 1222, what's the studying like in residency compared to in dental school or CBC prep? Well, it can be very hard to find time to study in residency. Sometimes you're working 80, 90, 100-hour weeks, and you're exhausted when you get home. Need to find time to eat, to sleep, maybe get some exercise in to keep your mental health and, physique up to par with whatever your satisfactory levels are. Yeah, you study when you can. In dental school, it's all studying, right? In residency, it's all work. So, think about that. What's the studying? You said that Rachel, is idiopathic condylar resorption rare? I got diagnosed and deciding prosthetic or rib reconstruction. Is it rare? Yeah, I would say that's pretty rare. That's pretty rare. From what I haven't seen that. I haven't seen that part. So it's rare. From the mixed dub desk, I have PVL. Am I gonna die? I don't know. Billy Horror, HORR. I need a lot of help. What do you need help with, Billy? Adam, what if you don't match into dental school residency? Can you just decide to work? Well, it depends because certain states in the U.S. you can just go and work after finishing dental school. Other states like California, like New York, you do need to complete a residency prior to working in these states. Oh, wow, we got a lot of questions. Let's do it. So as Des girl, Des, I let him extract my wisdom teeth. All right, Des, let's get him out. Reed Staggs 5, second-year dental student at IUSD and burnt out. What tips do you have? How often do you exercise? And what is your diet looking like? And then what's your sleep schedule looking like? These are the 3 things that I would ask you. Ashton, are surgeons typically uptight, especially residents? Uptight? Maybe, being uptight or loose and more comfortable really depends on your surroundings, like how other residents treat you, how your attendings treat you. I would put most of residents aren't necessarily uptight. They're probably just exhausted and very tired. Let's see. Dragon said, go Doctor Strange on them. I'm not sure what that means. Haley said, Reed Staggs, I dropped out of Temple Dental. Des, and I do it again. LOL. Des, you do what again? Selena Solis 444-888. What do you think are some solutions to this healthcare issue? Yeah, well, we need to incentivize patient care again. Patient care needs to be put at the center, and then we need to empower providers to actually provide that care again. We could start that by actually reimbursing care what it's worth nowadays. If you look at dental care, for example, the insurance companies and Medicaid, Medicare came out that whole right around like 2008 to 10, right? Dental care actually decreased their reimbursement rates of treatment. So that means now it costs like a dentist, say it costs them like $50 to do a filling, and insurance companies would pay like 75. Well, now they just lowered it to 60. That's essentially what that means in short, right? I'm using easy figures. So now you're just barely making a profit on fillings and stuff. Preventative care, right? Not taking out the tooth, but literally saving that tooth, putting a filling in. Preventative care. That's what it's all about, right? If you just let things go and you don't reinforce preventative care, you're actually allowing everything to get worse and worse. And now you get people in dentistry, for example, just losing teeth left and right. And that's what happens. You need to teach dentistry and oral care, oral hygiene at there's so much to go into this, but you need to start with, if you're going to actually have insurances in a country, the the company needs to do their job. They need to reimburse care. They can't stop picking things up and arguing with dentists and doctors like, no, well, I need to get on a phone for a meeting. Like, you're supposed to be treating patients all day. Pay the doctor for the treatment that was rendered, right? God, if they're doing something sketchy, well, their reviews on Google and Yelp will end up showing it over time, right? I'm not really worried about that, but you need to empower providers to actually render care again, and you need to allow patients to trust providers too. In addition to that, you need to let patients get their care. They can't afford things these days. They're expecting and assuming that insurance covers everything, so cover something, and they're not. So that's my start to a plan, and I could go even further on it, but let's get to some more. Haley said, read the Wall Street Journal article about medicine being a calling. Yeah, I mean, any profession's a calling to you. It's a personalized ambition, right? Guy said, do you believe in root canals? Yeah, root canals have shown to save teeth. So yeah. Sammy Drew, share the live. Thanks, Sammy Drew. Jerry, what if so bad, why medical school so competitive and hard to get into? Because think about it. They've made it so it's a hot commodity because it's so competitive and difficult to get into. And then you ask doctors that just graduate or in residency, or doctors that were around pre-2008, no one's actually happy. That's why it's so bad. And there's a lot of other issues. JFCJD, why would you be the sole provider in the OS office once you graduate, or with a partner? With a partner, I think that's better. DC, hey bro, do you know any international OMFS residents? Do you know what's the path to becoming an international OMFS? I do, but it's a different residency. It's not the same thing. And I do know some from Canada. SM said, can you say a quick prayer that President Trump avenges Peanut the squirrel? Oh my gosh, I saw that did you guys see Peanut the squirrel? That was the saddest thing. So essentially, Peanut the squirrel was a rescue animal, right? That it was a family, mostly like a dude. He would do like TikToks and videos and stuff to support. But they started like a nonprofit, like a charity for rescue animals. They had in their household, they had like a raccoon, they had the squirrel Peanut for 7 years. They had horses, I think they had dogs, and maybe probably other things too, right? But they had funds that would take donations to help raise them and also empower other people and support other people to get rescue animals and pets and stuff. And I don't know what government organization, but they raided the family's house and euthanized the raccoon and the squirrel. And it's like, that pet's been there for 7 years. Why now? And then it's also like in New York, I live here, and it's getting to be a bit more violent out on the streets. And but those people just kind of get let out the next day, and they're raiding people's houses for their pets. I don't know. I don't really know what's going on these days. It's a little bit weird though. That's for sure. Things are weird these days. Okay, we can settle with that. But yeah, Peanut, that's very sad. That's very sad. So we should all take a moment of silence for Peanut the squirrel. All right, let's move on. Haley said, at Jerry, money symbol. Okay. Haley said, I used to give tours at Temple Dental and tell people to go elsewhere. Wow. Why? I'm curious. Ethan said, hey, what's your birthday? You're cute. BTTM. Not sure what that means, but thanks, Ethan. My birthday is May 11th. DC said, hey, bro, do you have any international OMFS residents? Yeah, There aren't any at my program, unfortunately. Emmanuel Fuentes, torn between medical and dental school. Were you also torn? No, I was thinking medical school, and then I shadowed a bunch of doctors and dentists, and I was like, I'm definitely going to go dental school, and I left medical school behind. I suggest you getting enough exposure to both sides, because there's going to be a day where you're like, I am much more excited to go see this one and not that one, and that's going to be your answer. Medellin said, ortho intern here. Gotta give you OMFS guys props. You do some dope stuff. You too, dude. Yeah, I got a couple ortho buddies in the hospital, and yeah, man, I remember there was a kid who got off, that was coming home from work on a scooter and stopped short, put his foot out, and his foot just, and it was crazy because it kind of degloved up a couple inches up his arm. His foot was completely on the side, but his bone was just sticking out through his lower leg. And this orthopedic surgery resident just came in, and it's literally like in the movie. He's like, all right, 1, 2, 3, and just put it back in place, wrapped a couple things around it. Pretty dope. Jay, thank you, man. I appreciate the advice. Just finished my first semester of dental school. Thank you. Sure. Yeah, man. Anything I could do to help. And congrats. Finishing first semester of dental school. That's excellent. Ethan said, hey, what's your birthday? Yep, you got it. Jerry said, Trump had a concept of a health plan. I'm not aware of that, actually, believe it or not. LQ, I'd love to hear it. You know, that's the thing. Like, I listen to a lot of speeches, talks, interviews on both sides. Like, I listen to the Trump Rogan podcast. I listen to the Kamala Harris and Call Her Daddy podcast. I wanted to get as much non-distorted info of both sides, because both sides are getting distorted, right? I don't want any of that. I wanted to just hear the full picture of both sides. And I thought it was a great idea. And I think it's a really good idea to get uncut versions of both sides as well, you know? Just my thoughts. I hope you agree. LQI, sorry if you've gone over this in past posts. Did you do a GPR or non-CAT before residency? No, I didn't do a GPR or non-CAT. I just went right from dental school into oral surgery residency. LQI said, love your content, by the way. Thank you, friend. I appreciate that. Let me know what you want more of. What can I talk more of? Selena Solis 444-888. They're making light of Trump's comments about having a concept of a plan since they think you voted. I did vote. Selena Solis and his response to that, it was saying that he doesn't think Trump's policies will help fix the bad pat. Fix the bad pat. Wait, Selena, can you finish that? I think you got cut off. Oh, path of healthcare. LOL. Just to clarify from what I believe. So I wish I was. I'm not aware of what Trump's policies are for healthcare. I'm not. Nerdy glasses emoji said, have you ever taken any public health courses? No, I have not taken any public health courses. Caden Blazer, where to go? Wow, I got a lot to get to. Best way to prep for the DAT? Studying hard. I mean, there's a bunch of resources, but you could probably get them from other people that will be a little better than myself. January _, how to help TMJ pain. Well, I would go to a TMJ doctor and ask them to evaluate what you think. Like asking what I would suggest for TMJ pain. I don't know anything about your TMJ, so whatever I tell you might be completely off the deep end. You know, we don't want that. Judy Sell, okay, Judai Sell. Dusty Schrock, you don't need a residency to work in Cali. Are you sure? Because I was told you need to do at minimum a GPR residency to work as a dentist in California. Are you sure? Are you sure about that? Anna said, which dental schools did you apply to? I'm searching schools and applying to in Florida. I actually applied to UF. That was the one school I didn't get an interview at. I applied to six schools: NYU, Rutgers, Toro, Stony Brook, Buffalo, and then Florida. Florida generally takes in-state. I didn't get an interview there, rightfully so. And I got interviews and accepted to the other ones. Beanie Bean. I have minor speech impediment. Do you think they may prevent me from being a good surgeon? No. It has nothing to do with being a good surgeon. I think, in fact, you see people with speech impediments really making some exposure for themselves and what they go through on a daily basis with that speech impediment on TikTok. You see this all the time. I would use that to your advantage. That's a unique thing. Sometimes we have to own who we are and little aspects about us that make us who we are, right? And you know how many people are also out there with speech impediments that would potentially look up to you for sticking up for, being unique in a certain way? There's a lot of strength in that, and maybe you would do it. Yeah, no, it has nothing to do with being a good surgeon. You could definitely be a good surgeon. Peyton Price said, any advice to someone going through interviews for Gen Surg residency? Oh, yeah, man, good luck. Gen Surg is tough, right? That's 5 years, and then generally most do fellowships, whether it be bariatrics training or it be cardiothoracic. I know a guy who just matched last year into cardiothoracic. Wow, that's a lot. But Yeah, I don't know. The one thing that just scares me, it's like you're completely owned by the hospital now. General surgeons are generally only working in hospitals now. You can go out into private practice. I would recommend doing so. But yeah, most of them work for hospitals now. They make all the rules, you make no rules. You have very little power, if at all. There might even be like a nurse who runs the OR board, and now you're reporting to a nurse that just tells you what you can and can't do all day long. You see it all the time in hospital settings, and it has nothing to do with being a general surgeon or being a nurse or this and that. But it's just interesting because the dynamic prevents surgery and patient care from getting done ultimately at the end of the day. And it's really frustrating to see. But that's the healthcare world we live in today. Peyton Price, any advice to someone? Beanie Bean, that. Kerwin Chong, Brendan, I've been doing USMLE system by system. What's the best way to recall previous systems? By going through it again. I think it would be practice questions. You can star different topics, right, on Quizlet or UWorld, for example, and you could go back to them later on if it's something you think worthwhile to recall. Yeah, you just got to keep, is repetitions. Repetitions is your best bet, all right, Kerwin? LQI, second, Dusty. I'm a D4 from California and I've considered going back after my GPR, but you don't need it to practice. Great. All right. Guess you don't need it. Sawyer Adams, thoughts on 5FU for OKC treatment? Yeah, there's some good evidence that has been shown. What's the other one? Carnoy solution. They don't use anymore because that was causing like cancer or something. It's whatever. I should brush up on that. But yeah, 5FU is definitely an option. Selena, Celise, 444-888. Love hearing your take on how to fix this negative trajectory of healthcare. Yeah, well, this might not be here's the most important thing. We need to start talking about it. And we need some creative minds to help brainstorming solutions. And my ideas, or at least today, this might be way off and may not work. But the whole point is we can start talking about it now. And maybe 3-5 years from now, or maybe at some point in time, we can come together and say like, no, I think this is the trajectory of step 1, 2, 3, and so on to change the course and make it better again. And that's the only way we're going to get there. If we're not talking about it, if we're not, treading the waters of solutions, we're never going to see anything in our lifetime that makes it better, right? And the further we go down this hole, the deeper it gets to get out of it, right? We just got to talk about it. The average dental student is graduating, the average 50% or more graduating with over $250,000 of debt. That's a lot of money in debt. When insurance reimbursement hasn't increased in 10 plus years, in fact, it decreased 10, 15 years ago, you're never going to pay this back. This is just a fact. This is not what we're looking for. We need a brighter future. And we need to be able to incentivize smart, hardworking people to go into this profession too. And if it's just problems, why would anyone do it? And they don't. It's frustrating, as you can see, right? Because I want so much from this profession, and I want to give so much to this profession and make it better. But, it's not just healthcare, too. Across the board, we're seeing a lot of stuff. LQI, also, what are your thoughts on OMFS, on dental anesthesiology residency? Yeah, it's great. It's good. It's a new residency in specialty that's now recognized as of, I think, 3 years ago. And I would just really think about where do you want to work afterwards? And, dental students have very little exposure to what life is like, a career is like working in a hospital setting. So I would suggest shadowing a dental anesthesiologist. See actually what they do all the time. And yeah, you can work in private practice too. But how are you going to do that? It's not so widespread, so I would look into that. LQI, in terms of job market for them, most OMFS feel comfortable doing their own anesthesia. Yes, they do. Huru, this is so dumb, but I still do have a chance to get into dental school if I have a C in physics. Yes, you do. You do have, I think. Tor said, Meep Huru. Yes, Ultimate Rice Farmer. Hello, Ed Sheeran. Jor 5 Luca. Why so hot? Jor 5 Luca. Why so daddy? Alex Ram Zero. What's covered on CBSE? A lot. You could probably look that up. Jor 5 Luca. Where are you from? New York. Kelly Smith 6. What's up, Kelly? What's going on? Tristan said, hey, Brendan. What's up, Tristan? Tristan's my cousin. That's funny. That's awesome. Hope everything's going well, Tristan. Hope you're doing good. Kelly Smith. Yeah, Kelly Smith. Tana Belly, is ortho residency really competitive? It's extremely competitive. It is. Venti Macchiato. Kali, I'm in Los Angeles. What city? I'm in New York. Sawyer Adams, thoughts on 5. Those are my thoughts. Layla, have you ever been to Boston? I have been to Boston. Venti Macchiato, are you single? User 6890, aren't you in Grey's Anatomy? Yeah. No, not Grey's Anatomy. Venti Macchiato sends a rose. Pharmaceutical, thoughts on doing a plastic surgery fellowship after OMFS residency? Yeah, and I know people who have done that, but they go and did that, and now they're putting in implants to keep the lights on. I think you got to get a broader understanding of where healthcare is today and age, and we need people to do cosmetic and plastic surgery and stuff. But like, I think we got to fix healthcare before we can really, and we have to make the best people. We have to incentivize the best people to go into these things, And it's the whole landscape is flipped. It's not. E said Trump 2024, baby. Strat Guy shared the live. Thank you, Strat Guy. Edith Mason, I like your accent. Well, thank you. I'm not a fan of my accent, to be completely honest. It's this Long Island accent. K-Mock said, hi, where are you from? I'm from New York. Andrew Struble, I interviewed at 4 dental schools. How do you feel pass, fail, or letter grade is better? Honestly, I think pass, fail is better. And if you really look into that, you'll see why. Angelina Elizabeth 6761. Ugh, that makes me sick. I'm a hygienist, and my return on investment was a no-brainer. Like in a good way or in a bad way? I'm not as familiar with ROI of hygiene. Evan J. Dean. Ooh, I'm going to get going soon. Evan J. Dean. Did you do anything your D1 year to improve your application for OMFS? D1 year? No, just studying. D1 year is your first year of dental school. Just studying. Angelina Elizabeth. So upsetting how expensive dental school is now. Yeah, I mean, same with college. Same with medical school. Same with... It is so sad. And you're getting paid less than ever before in the history of dentistry. So it's like, how does this work? It doesn't. It's not going to in 30 years. It's very concerning. Jake Weber had my first OMFS interview last weekend. LFG, let's go, Jake. Congrats. I hope it went well. When's the next one? Bulls said, is UOP a good dental school for OMFS? I think it is. I don't know that one specifically. I know UCLA is, and I think UOP is right. UOP is the 3-year dental school, right? Selena Solis says, are you single? LOL. NLLJ and VJ. Do you think dental pediatric is hard to get into? It's competitive, that's for sure. K-Mock said, how old are you? I'm 30 years old. Bull said, yep, you said that one. Angelina Elizabeth, make 6 figures and school was DK. Wow, that's awesome. That's a pretty good, yeah, that is a good ROI, by the way. That's a really good ROI. I want to be a pediatric dentist, but still doing my master's have to have a better chance on getting accepted. I think you go for it. I think this year you go for it. You're getting a master's, good, but go for dental. If you want to be a pediatric dentist, that means you need to do dental school, and then you need to do a residency in pediatric specialty. I think you go for it now. I wouldn't wait too much longer. Jonathan used to work as a lifeguard at... Jonathan, what's up, man? Jonathan said, I used to work as a lifeguard at the New York Sports Club in Smithtown. Glad to see you succeeding. You're very kind. Jonathan, what's up, man? Good to see you here. Yeah. That's so funny. That's really funny. At the New York Sports Club, gosh, that's so sad that it closed. Honestly, that was such glory days at that sports club. We were going there for what, like 2008 to roughly 2020 when COVID hits. Yeah, 12 years. Dude, lifeguarding there, college, high school, dental school, I went there. Man, I really miss having a gym community like that, and it was such a good sports club. They had the basketball gym, they had yoga classes, the pool, a sauna. I need that in my life again. I haven't been able to do a good lift since then because I can't afford a gym membership, right? I haven't had a gym membership in 3 years. God, that's depressing. But I don't know, it's just a great gym. It was great layout and everything. Did you have to take out loans from Triple Ace? I didn't take out loans. K-Mock, does doing dentistry make your hands hurt? Yeah, sometimes your hands get sore. You give them a break and you get back to it. Carl, best dental school program in the U.S.? Well, that's subjective. There's so many good dental schools, good programs that most importantly it would need to be personalized to you. You know what I mean? All right, just a couple more questions. Atomic Art Welding said vote America. Cool. Carl, best MD school? I don't know what the best medical school is. Bull said, how much do OMFS make out of grad? Well, it depends on what area of the U.S., because I've seen a range anywhere from $350 to upwards of like $800 base salary. Base salary is a trick, though. My recommendation is percent. Having a percent production, a percent of collections. The reason being is that incentivizes you get a percentage of every piece of work you do. If you go for a base salary, the way they're gonna try and make money on you. So they're gonna want you to work more than that. You understand? But a percentage is in your favor because you get a percentage of everything you do. If you take a base salary, the advantage is for them, the people you work for, and they will take advantage of you. So I would be very wary of that. All right, friends, one more question. Biggest advice for predental students, get as much exposure as you get. That's from Sasha. Sasha said, biggest advice for predental students. The last question for tonight, friends. I would say try and get as much exposure to And this is for anything, not just predental, pre-med, any career you consider to have an interest in. Get as much exposure and one-on-one in-person shadowing, observing of that career, because ultimately that's what's, and get as much as possible, a lot of repetitions in a lot of days. It can be a lot, right? But you need to see what you are most excited to be in. And seeing it from a TV show, seeing it from a movie, seeing it from afar is much different from doing it. And the closest you can get to doing it is shadowing and observing. That's why I recommend get there, meet that doctor, meet that dentist, meet that lawyer, spend time with them. It could be anything. It could be plumbing. Go there, spend time plumbing with that plumber, okay? And see if you would be excited in doing that every day for a considerable amount of years, okay? All right, friends. Wishing you a great night. I'm packing up. The top 3 listeners on this TikTok live, I'm gonna be giving you a shout out on the podcast. All right, I'm recording this on the podcast, so it'll be going out on YouTube channel, Spotify, Apple Music. In the caption, I'm gonna put the top 3 listeners who stayed on for the whole live. All right, thanks for coming on, guys. This is TikTok live number 37. I'm gonna be signing out, and go vote.